In the early days of the pandemic, when many hospitals were first overrun with coronavirus patients, constant shortages of personal protective equipment meant healthcare workers were constantly putting their own lives at risk. At least 1,000 U.S. healthcare workers have died from COVID-19 so far, most of whom had inadequate access to PPE. And still, more than 6 months later, some of the most essential pieces of protective gear, like N95 respirator masks, are in short supply. So how is a country that boasts it offers some of the best healthcare in the world so unprepared to protect its workers? That is the subject of a new report from Frontline and the AP.
We send soldiers into battle with the equipment that they need, yet we were asking nurses to do the exact same thing, but without the equipment that they needed. Those who were in position to ensure that the supply chain was being maintained, they failed us big time.
I'm joined now by the Associated Press investigative reporters behind the project, Juliet Linderman and two-time Pulitzer Prize winner Martha Mendoza. Thank you both for being here.
Thank you so much.
Juliet, let me start with you. It is very tempting, given how clearly the president has mishandled so many aspects of this pandemic, including his own diagnosis, to lay the blame on him. But you guys came to the conclusion that the problems actually started quite a bit before President Trump took office. How far back do we have to go to start assessing what went wrong here?
Well, we spoke with officials from multiple administrations, and we tried to really get at the root of, why these problems exist and how long these warnings have really gone unheeded. And so, we went back to the early 2000s and we investigated what happened during the H1N1. And what we found was just a sense that supply chain, the fragility of supply chains, that was a known issue, but it wasn't really taken as seriously as you would think. And now we really see the consequences playing out.
Correct me if I'm wrong, wasn't a law passed or I can't remember if it was a law or an executive order, but wasn't there official action taken in the wake of H1N1 that was supposed to basically say, okay, we've recognized that there's a potential problem here and we're going to make sure that we're prepared going forward?
There was efforts made, but there was nothing that was both a plan and an implementation requirement. So without those wheels in motion, what we found was really stacks and stacks of plans.
And in addition to that,
go ahead. Sorry, Juliet.
H1N1 was the largest deployment of the Strategic National Stockpile. And that is, a stockpile of supplies meant to respond to a disaster like a pandemic. But the funding for that is, it's up to Congress. It is. And so we've spoken to people who say that was part of the issue.
Were there specific shortages of specific items that people were warning about early on, or was it more of a broad-based, we need to be sure that we have just enough supplies, generally speaking?
Within the White House, in January, emails were shooting around saying, folks, we're going to have shortages, and they were very specific. N95 masks, gowns, gloves, and as well as needles and syringes. So they knew what there was going to be shortages of. They did not take action, and so people who even made those items in the U.S. continued to sign contracts with other countries and export them. What Juliet and I noticed first really were N95 masks. These are the precious masks that really can help medical providers not catch COVID from patients, and when they're worn properly and when they're made properly, they really do work. We took a look at why are nurses wearing garbage bags and bandanas, and we looked at import records and we found they're not coming. Shipments that usually came a couple times a week were not arriving at U.S. ports. They had stopped completely because China and other countries, first of all, were being hit by the virus, and then second of all, needed to keep their products within their own countries to take care of their own people.
I want to ask about the supply chain and where it is based, because I believe, Martha, that in the course of that answer, maybe I'm conflating two answers that both of you gave, there are domestic suppliers of this equipment that people need to be able to get their hands on, and there are foreign suppliers. You talked about domestic suppliers sending their materials elsewhere, which is why they weren't able to send it here. But my understanding is that to a large extent, the demise of American manufacturing and our increasing reliance on foreign suppliers is a big part of this story, if not the story itself. Am I right about that?
Absolutely. 90% of America's medical supplies were coming from overseas, and most of those were coming from China at the onset of the pandemic. So domestic manufacturing made up a fraction of supply and continues to, even though you've seen some ramping up. And so, yeah, if you're looking at where the supply chain is, it's a world away.
Tell me if I'm right here, Julia. My sense is that the Trump administration, rather than working within existing channels to make sure that people got the equipment that they needed to fight the pandemic, tried to some extent to reinvent the wheel, to create new mechanisms for the distribution of this stuff, and that those new mechanisms didn't function that well. Am I being overly harsh with that assessment?
Well, I think you may be referring to Project Airbridge, which was an initiative to actually fly supplies from manufacturers overseas into the U.S. And we spoke with lawmakers who said that they really didn't have any visibility into where those supplies actually went. There's been a lot of criticism about Project Airbridge. And additionally, as we saw, states and local governments were really told to fend for themselves, essentially. And so you did see a lot of competition and a lot of scrambling in the early days when this PPE really was precious here because there simply wasn't enough.
And that's something, as you guys know, that the governor here in Massachusetts, Charlie Baker, has complained about. He's a Republican, but he said that the administration basically put the states in a position of vying with each other for these crucial materials. Since we're talking about something that's very important, but also talking about it in somewhat abstract terms, I want to bring in some of the voices that are featured in this Frontline special. First, you two, I believe, spoke with a woman whose sister was a nurse who died in the course of treating someone who I believe was asymptomatic but carrying COVID. Let's take a look at what she had to say and a listen, and then when we come back, I'd love to hear you talk a little bit more about her situation.
She didn't feel safe.
It just really hurt my heart just to know that my sister wasn't protected. All of this could have been avoided.
I felt she would have had the proper PPE. She would be alive today.
What else can you tell us about her sister's story?
Well, Sandra Oldfield is the nurse, and if I were ever sick, I think I'd want her to be my nurse because she sounds amazing. She and her fellow nurses at a Fresno California Medical Center, were asking their managers for N95 masks because they didn't feel that the surgical masks they were being handed would keep them safe. And there were not enough N95 masks in the market. There still aren't. And so they were exposed. About several dozen nurses were exposed to a patient who was asymptomatic. 10 got sick. 3 were hospitalized, and Sandy spent 2 months very, very sick and suffering before she passed away. The nurses were crushed, but her sister and her family, of course, are really suffering. They're heading into Thanksgiving and Christmas without the sister who was the person who held their family together. Her sister had coffee with her every morning. She now goes to her grave to have coffee with her. Her niece is had been planning to be a nurse, inspired by her auntie, and still plans to be. It's important to keep in mind, this is one of hundreds and hundreds of healthcare workers who have been lost in this country, and you can point to lack of PPE as a reason for that in many cases.
Let's take a look and listen to what gentleman, I believe he's a rear admiral who played a key role in the FEMA supply chain stabilization effort. He was, to my eye and ear at least, fairly dismissive of complaints that have been raised about the administration's handling of this issue. So let's take a look at what he said.
Why hasn't there been
better coordination?
From where I sit, I see lots of coordination. Governors have as much visibility as I do to where supplies are going. So the secrecy and the lack of transparency is absolutely unfounded.
How can he say that when we've heard governors say repeatedly the exact opposite?
Well, there has been a major disconnect in messaging from the White House and from what we're hearing from state and local governments and also doctors and nurses on the ground. Admiral Polovchek also told us that he doesn't believe that there are shortages still, that he thinks that we have an adequate supply of personal protective equipment in this country for healthcare workers. And he wasn't sure why a doctor or nurse might say that they didn't have what they need. But just 2 weeks ago, a Government Accountability Office report came out that actually confirmed that there are persistent shortages. So there's just been a disconnect there.
That sounds to me of a keeping with the president and his administration's approach of generally accentuating the positive, and if things are going poorly, you don't talk about them and see that as a way to make them start going better, make the problem go away. My interpretation, not yours. Before we wrap up, where are we at this point as we head into the winter, which is a time when a lot of people are bracing for spikes in COVID, of course accompanied by the spread of the flu? Are we in a better spot than we were last January or February?
I'd say in a lot of ways the United States is in a better spot. There's more understanding about how to care for people with COVID, and also people have a slightly better idea of what to expect. That said, the Centers for Disease Control has revised its guidance about how to use basic medical equipment so that it is being reused. And that's in direct contradiction of the manufacturer's rules when they're making this stuff. They're saying you should wear it once, you should take it off and throw it away. Don't go from infected patient to infected patient wearing it. And that is now kind of standard operating procedure, is to keep it on, keep your one mask on all day, maybe more than one day. The second concern that Juliet and I are really looking at is needles and syringes. Though there were White House warnings in early February, Peter Navarro warned that there's going to be shortages if they don't get them now. But the largest order for needles and syringes, for $500 million, has gone to a company with a new device that does not have FDA clearance. We have no information that they're actually making it yet. And so at this point, we're looking forward and wondering how that vaccination campaign is going to work.
I hadn't known that about the needle supply. That's such a dispiriting note to end on, but we have to leave it there. Juliet Linderman, Martha Mendoza, thank you both for diving into this.
Thank you.
You can watch America's Medical Supply Crisis tonight at 10 right here on GBH2. You can also find it now on the PBS video app and online at pbs.org/frontline.